the knowledge base that the police have is almost zero about medical cannabis. Economy is at an all-time low. Unemployment is at an all-time high. We are still in the middle of this pandemic, and now we have mass demonstrations of mass people. We're going to have to figure this out together. Divisiveness does not get us anywhere. Divisiveness gets us here.
People always telling me you gotta speak your mind, but I just wanna thank my friends for giving me that drive.
So we're here. My name's Colette Florido with Dr. Kelly King of Relief MD, the Center for Medical Cannabis. And we're talking about a few different subjects of what's happening right now in the cannabis space, what's happening in the world. We're talking about COVID-19. We're in the middle of some very heavy-hearted protesting. And we're talking about our own health. And so there's a merge of challenges happening at the protests.
Yes,
we have
absolutely
bubbling over of frustrations, pent up for decades, for centuries, for some people, and whereas others have this quarantine pent up frustration. No matter how deep yours runs, everyone's at a boiling point.
Yeah.
And they've just gathered together.
Yes.
We just finished saying it's not a good idea to be
together. Right.
And now we're together.
And now we're together protesting and yelling and shouting and screaming in a mass of people.
Right.
And it's scary. It's terrifying. I am heartbroken that we are still having this conversation 50, 60, 70, 80, 100 years after, we've had the civil rights movement, and we've had the Revolutionary War, and we've had, this is our legacy, and this is our burden as Americans, and we're going to have to figure it out, because one thing this has taught us, even with the COVID-19, is, that the slogan that we all have seen throughout this is, we're all in this together. We are all in this together. We are going to sink together, or we are going to rise together. And that can be applied to COVID-19, that can be applied to race relations, that can be applied to everything that we are dealing with.
The economic situation.
The economic situation. We're going to have to figure this out together. Divisiveness does not get us anywhere. Divisiveness gets us here. And, so maybe in a way this is a culmination of all of this, and this is going to force us to figure it out, or to not. We are going to see a lot more virus. I think that's just a scientific fact at this point. We are still in the middle of this pandemic, and now we have mass demonstrations of mass people running through the streets, some with masks, some without. So I think we are going to see spikes in this virus, and this comes at a time where our economy is at an all-time low, unemployment is at an all-time high, and then we put racial tensions and civil unrest in the middle of this. It's just a perfect storm for a lot of things to get worse. And so
I can see a flux of people coming and knocking on your door here to make an appointment, because the anxiety has just gone through the roof. I think that we're all feeling that unsteady ground, and that where are we going to go from here? So I think there's a lot to be said about what we can do to pick up the pieces. So let's start with the COVID-19. Okay, so everyone's feeling ready to get out. We're all feeling like it's time to get back with friends, with loved ones. We've definitely had the opportunity to live in isolation and to know how that affected our psyche, how it affected our well-being. But we have to be cautious.
Mm-hmm.
How do you see that changing? How do you see us doing that today to stay healthful and vigilant?
As we go back out, I think we're going to have to go back to the basic principles. If you look at any of the pandemics or any of the epidemics throughout our history, it's really been fueled by human behavior. Okay, and you look at the bubonic plague, that came from rats, because we had rats in those big drafty councils that we were just letting run around, and fleas, they bit the rats, then they bit the humans, and that's kind of how the bubonic plague spread. Bubonic plague had 5 different spikes in history before it was finally eradicated. So it comes back to human behavior and how we change our behaviors. So to your point, we're going to have to look at social distancing. We can't always social distance. We can't. And yes, we're going to have to probably wear masks more often than maybe we're comfortable with, or more often than we would like. But we're going to have to be cognizant of that. The hand washing, those hand sanitizers, that's the only way to keep disease down and to keep viruses down. Spraying things down. Those are just going to be commonplace fixtures in our lives now.
And it seems to me like if we're not good at it, because we've seen how there's some folks that are just not doing it. They're not going to do it. There's another part to this, which is going back to your own immunity, taking care of one's own health, having your own health under control. So now is the time to focus your attention on those habits that might be not so helpful. To look at the plant as the cannabis plant as a form of medicine, and to help boost your immunity.
Absolutely. Exercising, being mindful, taking in those supplements that are helpful, that we know that are helpful. Doubling up on things like vitamin C, doubling up on your elderberry and your zinc and all of those things, just to keep your immune system as strong as possible.
So there's 2 sides to it: be protective, but also be proactive.
Yes.
We in the cannabis industry already understand the uphill battle that one faces in trying to change history, the course of history. We see how it impacted the judicial system, and how it impacted the penal system, and we see patients. We hear time and time again, patients who would have been patients, but at the time wasn't seen as a patient because the plant itself was not seen as a legal drug. So these people are now, have been incarcerated. Their lives have been upended. There's a interesting intersection here where we are talking about trying to be proactive with our health with cannabis, but we're also looking at what we can do to help support the protesting, to help support the change that we all are looking to accomplish, so that there isn't racial discrimination. And the cannabis industry focuses their attention on that. What are some of the things that you hear people talking about that could impact our current protesting situation and the racial challenges that we have?
I think we have to go back to what is fueling all of this. The divisiveness that's fueling all of this, the racial tensions that are fueling all of this, and it's disparities, right? It's disparities between men and women. It's disparities between income levels, the haves and the have-nots. If you look at the penal system has historically been slanted towards those that are Black and that are brown. Those are the ones, because they can't afford the legal fees and they don't know how to navigate the legal system. Those are the ones that have been unfairly targeted. We know just by looking at the news that these are the ones that have been racially profiled. And that's what we're seeing from these demonstrations. So how can we address that within the cannabis industry? That can be addressed in many ways. First of all, we have to recognize it, and we all have to own that. We can look at maybe the legal processes that I know California, they are looking at taking people who have been incarcerated for cannabis offenses and cannabis possession, and they are looking at overturning that and letting those people out of incarceration. We should probably do that collectively in the United States, or at least start introducing bills that will do that if your offense is purely for cannabis, especially if now cannabis is legal. We also need to look at getting more minorities into the cannabis space. You have minorities that are incarcerated for doing the exact same thing that dispensaries are now doing openly and making a whole lot of money. And
the folks that were incarcerated at one point are not being allowed to work at these places because they've been judged for their incarceration.
That's exactly
See the irony
right.
here?
Yeah, that's exactly right. And so that really needs to be addressed head on. It needs to be addressed with the legal system. You have the police force in many of these states that have legal cannabis. I know here in Florida, the police force, the knowledge base that the police have is almost zero about medical cannabis. Just them not even knowing what the card is supposed to look like, and stopping people and looking at the card and thinking that the card is counterfeit for some reason, or stopping people and telling them that because they have a concealed carry card and a cannabis card, they're somehow committing a felony. That is just not true. It's an ignorance of the current laws, and when you have your police force being ignorant of the laws, you really have a problem.
Right.
When they're the ones that are supposed to enforce the laws.
I think that's what we're seeing here. The few bad choices that a few select people are making are being caught on camera because they're doing it to the camera people that are supposed to be allowed to take the film and take this in. So there's a lot of that miseducation or missed opportunities for education.